I take up somewhat similar situations of collapse and fainting. Fainting is a partial or total loss of consciousness, often occurring without warning. It is caused by lack of food or by reduced blood flow to the brain or by a heat stroke. Recurring episodes call for medical help. A sensation of dizziness or lightheartedness followed by partial or total loss of consciousness occurs in fainting. The vision is disturbed. Numbness or tingling in any part of the body occurs. There can be epilepsy, uncontrollable twitching, stroke, shortness of breath, bleeding from the digestive tract, low blood sugar levels in diabetic patients, chest pain, palpitations, pale face, fatigue. In collapse, a person's physical limbs also collapse simultaneously and there is a loss of consciousness most of the time. Clear the airways in the nose and the throat of the person who has suffered a fainting fit or collapse. Pull the jaws outwards and backwards, downwards and backwards. If there is no recovery within a few minutes, start artificial respiration. If there is no pulse, start cardiac massage. In any case, seek a doctor's help immediately. No alcohol should be given to the patient when he comes around. Only sips of water if he asks for it. In homeopathy, we give acetic acid 30 when fainting fit occurs because of anemia. The face is pale, there is headache, the thirst is unquenchable. If a person faints out of fear, anguish or sudden loss, aconite 30 is of great help. If the fainting comes after concussion, arnica 200 should be administered. If the fainting comes as a result of shock, weak pulse, icy coldness all over the body, give camphor mother tincture, 15 drops on sugar every 10 minutes. There would be a heat stroke, breathlessness. If the fainting is caused by excessive discharges from the body anywhere, blood, mucus or anything, stool, China 200 will be of great assistance. These discharges can be in hemorrhage, menstruation, in fevers, in childbirth. In cases of heat stroke, administer Glow Noine 30, and in cases of epilepsy, Cuprum Met 200 gives quick relief. In cases of collapse, camphor mother tincture has already been advised. But collapse in a person who has been perennially sick, or in cholera, in typhoid, Carboveg 200 has to be given and continued for weeks together, 4 times a day. This can be a state of collapse in cholera, in typhoid. The face is puffy and blue, an imperceptible pulse, imperfect oxygenation, last stage of a sickness with copious cold sweat, cold breath, cold tongue. As already stated, in epileptic collapse, Cuprum Met 200 comes handy. There is jerking and twitching of muscles. The eyes are fixed, staring, sunken, glistening and turning upwards. The face is pale, the lips are blue, the jaws are contracted, there is foam at the mouth, fingers are stiff, turned inwards, cramps in calves, insoles, and there is unconsciousness. Collapses in a surgical shock with acute vomiting and diarrhea of thin, copious rice water stool, cholera, gastroenteritis, cold sweat on the forehead, the face is pale or blue, there are cramps in the extremities, the medicine would be Veratrum L1000. Both the situations, collapse as well as fainting require urgent attention, get medical aid, but administer homeopathic medicines as selected on the basis of symptoms, there would be relief. I have seen in cases of epilepsy, cuprum med 200 is of great help. So in perennial weakness which leads to collapse, carbo-veg 200 is the remedy. For immediate relief, camphor mother tincture as prescribed, 15 drops on sugar every 10 minutes ought to be given. In cases of cholera, diarrhea, uncontrollable diarrhea, watery diarrhea, loose white stools, veratramel 1000 is a remedy which usually cures the situation. It's a frightening situation, but help is available in homeopathy. Thank you for listening to this video.